and get more people, reach more people, and hopefully one day actually make a difference in the world. And you all know what end of grant is. It's part of more and more funders like CHR are asking for this, or requiring this actually in the grant application, which makes a lot of sense. Why does it matter? Well, everyone knows sort of the classic, I think it's 17 years on average it takes to take the research findings and get them into some kind of application in the real world, and we want to shorten that. So this comes directly from, well, you're about to see where it comes from. I took a course called End of Grant KT. I found it online, and it's very well led and offered by, you can see who it's offered by, Unity Health. I don't like to just read the slides. You can read them yourself. And it was largely produced and narrated by Dr. Sharon Straus, who's very well known for leading a KT Institute in Toronto. And she did, I'd say, 8 out of the 10 modules of the online course. And it was very good. And I have saved them all on the drive for us to all look at later if you wish to. And the reason I have this slide is to remind you that we have our own hhscb.ca website, of which I'm happy to say our own JD Schwalm is director of this organization. I'm signed up for a webinar. I suggest you check it out. There's one coming up December 16th about KT and implementation. So it's a free webinar and I'm gonna check that out. So just to remind you. And the book here is a wonderful book that I read years ago, and it's very dog-eared by me. And you can see Why Science Needs Story. It's one of the best ones I've read. I have quite a little collection of these around science communications, and it's great. It talks about the importance of translating into, so I just put that out there. I highly suggest it. I have a copy if you want to borrow it. So as I say, this was the source of my course. And I'm going to, the best part of this talk today is that we do have an out-of-the-box template. I asked the Dr. Straus and her team if I could share this with PHRI, everybody, and she said yes. So I have a beautiful out-of-the-box template, and who doesn't love that, to do all the thinking for you when you go to make your own plan. And again, it's completely available to you, and I'll tell you where later. So here we go into the KT plan, step by step. The first step is obviously what is the goal, and I'm going to explain to you what the difference is between these two check boxes. By the way, for questions, just hold them to the end, just hold them to the end, and then if there's anything I've missed, I'll get to it. So first you have to explain your goal, obviously, and what's the difference here? So this box, behavior change and / uptake, is also known as implementation. So what is your goal, dissemination or implementation? And here's the difference primarily. You got your FYI, spreading, sharing. Hey, did you know? Did you know that? And you got your implementation is, we want to change behavior, right? We want to change something. We want action. For dissemination, really, it's best for a single study or review, obviously at the end of your end of your research. And implementation is usually much bigger than that. It's multiple studies and synthesized. For end of grant KT, the course told me that primarily you're really expected to do dissemination. So that's a good thing. It's a lower branch. It's much shorter process. And the other one, I'm not going to get into implementation today, although there is quite a bit of information I learned about it. So anyone working on a bigger project around that, today you're highly encouraged to involve your knowledge users really from the start and all the way through to the end. Now, dissemination, there's two types of dissemination we're going to talk about, passive and active, or neither, meaning, are you really at that stage? Like, not all knowledge needs to be translated. So is it mature, valid, detailed, in context, and is it meaningful? So that's the first starting point. So dissemination is what we're going to talk about because that's end of grant KT. Two types of that. You're going to recognize these types because one audience, one message, your audience is, at least somewhat pretty familiar with the topic and at any stage of research. Well, that's to your right here. You can see, I'm not picking on Jessica Spence here, but this is her speaking at ESC a couple of years ago, and the publications. So medical, biomedical science sessions, conferences, and that's your passive. And active is not one audience, it's different ones, and it's a tailored messages for each of those. And they don't know your topic, maybe not at all. And it's your final, not any stage, but your final stage of your findings. Active, so for that type of dissemination, You need to think big. You need to think out of the box, not just publications and conferences. So you need to think podcast, YouTube channel, some kind of e-learning, a tip sheet, a patient guide, something like that. Actually, you want to hear something funny? I was on CIHR's site, which I did check out extensively around this end of grant KT. They actually said, think media arts, think creative, maybe a play or a film, which actually I found kind of amusing. But hey, who knows? The government's thinking creative. Um, yes, I'm showcasing two of our cronies here today, and the reason I am is this is, for example, our YouTube channel for PHRI, and this video which I did with Isabel. She's being interviewed by Daryl Leong about the benefits and the importance of mentorship and what she gets out of it here in Hamilton. It's actually, you may think that's not a lot of views, but it's actually one of the top views in our on our channel by far. And so that was an effective use of communications. That's a little different than just the regular ones. And then here, I didn't do this one, but I really enjoyed that this journal, Thrombosis and Hematosis, interviewed our own Alex and then put it up on LinkedIn as an article, as a Q&A. And I thought that was a very effective and different way to get out information about his study, Averos, I think I'm saying it right, open label long-term extension. So here's some examples of when you tailor your message. So there's many here. So you've got your mainstream global mail, media, traditional, and can be a little too scattergun, meaning you're hitting everybody, moms, pops, grandmas. You don't know who's in that audience. But if you want more targeted, you can see in the bottom corner family medicine forum. So you're really targeting family doctors there. You've got newsletter in the top right corner. So you got newsletter going to a select audience. In the top left, you're going to see a very popular thing today, which is like data infographics. So having a pictorial way of showing the data that came out of your study is very popular. People respond well to pictures, myself included, even though I am a writer. Next up is you've established your goal, it's dissemination, and you've got like one or two sentences very clearly saying what the goal is. Now, what would you like to share with the public, or not just the public? We'll get to audience. Well, these are just a few examples of things you could share. I'm not going to read them because you can all read, but there, as I say, there's so many different things you can do, including products and services and commercialization. That comes off the CIHR website. 90% of this talk comes from the course I took from St. Michael's Hospital and a little bit from my own research into the actual grant, the funder. I just found this yesterday on Twitter and I thought, whoa, rock on. So I actually retweeted it and said impressive, because here's their summary for the year of what they've done to Knowledge Translate. And you can see it's quite robust. So they're really doing this well. I haven't checked out all the guides and tools and videos, obviously, but I'm impressed by that. The next step up is, who are your users and target audience? This is so important. I can't even stress enough this. In my whole writing career, every time I was asked to write something, I'd always lead with the question, what's the objective, the goal, and who is the audience? Who am I writing this for, or making a film for, or podcast, right? And this is you get your primary and your secondary. Not everything you do for KT will have just one audience. And so you need to think big, but they may just be one of these four here that you see, or maybe more than that. And don't forget policymakers. We often focus on doctors and patients, and we forget sometimes that there's maybe more people we can reach that are influencers and actual government making a change. So exhaust the possibilities, just do this brainstorm blue sky with your team around. It could be all of these things that you see here, right? There's some powerful lobby groups. For example, parents of children with autism. There is very powerful lobby groups working at government levels, at all the levels. You might be able to piggyback on their efforts, get some material over to them that they'll share, and they have a lot of followers. Think big. Specialized media, a targeted type of magazine or general, social media, more and more in our own space, med Twitter and cardio. There's a lot of action there. Industry, you can see the list is very broad. So exhaust that list and see how many audiences are appropriate. Then what would you like them to do? So it's an action, okay? It might be as passive as read or watch the video, read the report, Or it might be fill this in when you get to visit our unique website. You have a little mini site for your project. Fill in this form. We're asking the media to do a lot more, of course. Hopefully they'll come and interview us and such. And policy, read this summary. Make sure it's a nice, short, simple executive summary. Start a working group on the topic. So you can see and you're going to have to ask them to do that really specifically. You can't make any assumptions that they'll know that's what you want. Barriers, always doing anything. You got to look at what's going to keep people from doing this, aside from the common things of, that they just don't really care yet, but you're going to make them care. So there's three things. There's a huge part of this training I took around psychology and quite deep actually around these three areas that drive human beings. What are we capable of doing? What emotions are behind our decisions, whether we're conscious of them or not, and what opportunities do we have in our life? And we may not have the resources at all to do focus groups, but even just talking to stakeholders and even just making your own observations and talking to peers and reading reviews and literature, like reading the literature, you could probably identify them. And here's a great list I made up myself of just a few of the things I think are barriers to Canadians. Things from literacy. We sometimes assume everyone has the same degree of literacy. New Canadians may not. Also, people who are born here may not. That happens. We assume Wi-Fi access, and especially in remote communities in Canada, that may not be so, or more marginalized places like in the North End, where I live here in Hamilton. You got your money constraints. You got your skeptics. Your anti-vaxxers, don't believe in science. Doctors might think, well, this isn't the status quo. I've never told my patients that. So all of these are barriers that if you can brainstorm them and write them down, it doesn't take long, then you can tackle them with your strategies, which is the next bucket. And notice on this sheet, which by the way is a direct ripoff of the template that I've procured for you to use, you've got different columns depending on your audience. So these barriers will be unique for each audience, and so will the strategies. So this is one of their examples around a barrier, and then a strategy that they've used to address that. So one is very skills-based. If you remember the three buckets of skills, opportunities, and your beliefs and emotions, and then they've got some ideas for you there, right? Conferences, hold sessions, stuff like that. Where's my example? Oh, not yet. Okay, key message. So then after you've done that, you're going to look at your message. This isn't as onerous as it seems, perhaps. It's really quite straightforward, but something you've got to really focus on or it won't be effective. Every key message, regardless of whether it's a doctor, a patient, a policymaker, another research community, why should I care? What's in it for me? This is always the case for every audience. You need to be bare, direct, just the essence. Honestly, elevator pitch, although cliche as heck in business world, do it, practice it, one floor, go up, say it out loud. What is the nub of your key message for each audience? And there are tools out there you can use to assess whether you're using like 5th grade language, English, or how simple, how plain, or you can run it by me because that's what I'm here for as a professional writer. Now this is straight off of their example. I'm going to give you my own example from PHRI, but this is when they had a lot of the message is similar. So I read for you where there might be different messaging. So you can see yourself if you're going after the top people, the chairs, you want there to be awards. That's the message you want to tell them. There should be workshops. And then if you're going after admin people, you're saying make it part of your process when you're promoting researchers. And then the last group, the researchers, document, etc. Not the best example in my opinion, especially when you get down below with the messengers and they have local champions. I don't think that's specific enough. My example is a recent release we did on tips 3. Well, I didn't do it. I'm not a researcher. I helped a little bit with the press, the media launch and the communications with our national leaders. And you can see here 3 distinct audiences. We didn't necessarily target them all, but we could have. So I use this as an example. So with the poly pill, with policymakers, it is not regulated, the poly pill, in every nation, not yet, not in Canada, for example. So how would you approach them around seeking regulatory approval, some ideas around generic drug makers and insurers working together, again, this is not well researched. These are just examples. General public, that one's easier, and we did promote that one quite a bit about taking one is easier to remember and it's more pleasant. If you've ever had to take many pills a day, and most importantly for the developing countries, it's lower in cost. So depending again where your general public is, you would put a lot of emphasis on the cost, for example, as the secondary message might be the taking one a day is easier. And then the clinicians, a totally different message than you can see the other two, which is a little bit of peer pressure, right? Did you know that your peers are on guideline committees are advocating for polypill, and large bodies like WHO and WHF are advocating? Also your patients, right? You want to get to them that way. Maybe they'll be more compliant with meds. And I put this as I'm the reality of doctors, and I know we have some family doctors amongst us today, but is there less prescription burden? I don't know if that's even a real obstacle. But this is just an example of how you can break down the key message for your same research findings. Traditional media, I'm really sorry to report there's a deficit these days, a decrease big time of health and science specialists. I feel like Canada just has Andrew Picard left at this point. It's kind of sad. So you're getting a lot of general assignment and young interns, and they don't know a lot about the space of health and science. So dumb it down a lot. That sounds kind of derogatory, but I mean, make it simple. The other thing to always think about is largest, longest, first, etc. They love that kind of approach. So if you have any kind of unique angle that can fit into that, then you need to be putting that in your message. Obviously localized, depending on which media it is. Visuals are important. If you can't afford to do video or get a partner to do video, unfortunately, PHRI does not have a staff videographer. McMaster Faculty of Health just got there first in a lot, like that's, yeah, it's a hard resource to find. However, I do use local ones when I have an important enough study and I have the approval of my manager. Photos, I can help you procure those, but you should supply them for sure with all your, for traditional message, they want that. Those data points I showed you earlier with the big pictures, like the infographics with the, you know, attractive data points, they like that a lot. It's better TV or better in print than just lists of numbers. Get a quote, make it as quote sexy, as interesting as you can. Prepare that ahead of time. And TV, make it even simpler and even more visual. And it's going to be short. It's going to be so much shorter than you think it was going to be. Ask anyone who's been interviewed by TV, Richard Whitlock. It's incredibly short. You know, you talk to them for 10 minutes and they use 10 seconds. And if you're not sure what a busy editor reporter wants, please talk to me. I have been both for many, many years, so I am going to know more about that. Oh, that's back to the slide. I don't know why. Whoa, what happened? Okay, now social media, which is very important in our space, increasingly so. And when I took this job, I was pleasantly surprised to see how impactful it was. And we weren't on Twitter, and I put us on for that very reason. We're about to come 3,000 followers now on Twitter, 2,500 and change, I don't remember. So some of the tips I'm going to give you is don't ever just waste space of a tweet. Always think strategically about, are you driving them somewhere? I like them to go to our page, our study page, not our homepage. Never drive them to a homepage and make them wonder where to go next. Drive them to a study page or your article published on the journal, and make sure you get some traction out of them and they spend some time looking at your stuff. Hashtags, at accounts. A little tip here, which I know the editor of Nature Cardiology Reviews the other day, he and I were talking about tips 3, and he did not know this tip, and he was grateful I told him that you can attach a photo or any drawing image, and then you can tuck under that photo, in that photo, up to 10 different handles on Twitter, and you don't waste your precious 280 character count. Anyway, I won't get too much into this. Try to promote other people's content too, and it's follow, and they'll follow you back if you have good content. And obviously best behavior. I give you a couple of recent examples of some tweets I put up showing you all the handles I've used. There's 10 embedded in that photo, and then there's a few more in the text, and you can see a link in there. It goes directly to video to watch this. I've got some hashtags, especially ones that are being highly followed right now, diversity and inclusion. There's an example. And there's us. And you can see I've even put it in my profile. I've even used popular hashtags, EAPS, which is EP. Obviously, you know who those are. That's the AFib crowd, and you get cardio Twitter, and you've got all that stuff there. Followers, you can always check out who other people are following, and it's all transparent. You click on their followers list and you click on their following list, and you can see everybody and maybe get ideas of who you should be following in your space and your particular area of expertise. This is just some of the recent people following PHRI. So the 2,500 that are following us, or the 26, are all very qualified people and interested in our content and related. Too much on social media. I don't know what I'm showing here. Retweets, very important. Getting a lot of traction. Canadian Medical Hall of Fame, BMJ, lots of places now are retweeting our stuff, which is great because it's easy dissemination. The hard work is up front, but then after that, it's easy. They do the work for us for spreading the word. If you have something you want to promote, please do not hesitate to send it to me. I am there to out your stuff and to share your stuff. So just send it to me. I do not advocate you getting on your own account, especially if you don't have many followers, and you won't get as much traction that way. Send it to me and I will promote you. Credible messenger. Okay, so again, this really should align with your crowd. Is it patient, doctor? Is it lobby group? We talked about that. Make sure the spokesperson you have, you can have more than one, but they should talk one per audience exactly to that message. And they're credible, so the person gets, the audience goes, oh, you're one of me, I get you. Okay, gender and racial diversity, you all know how important that is today. Try not just to have the white man speaking all the time as on your message. Align the message, obviously, and you'll keep your eye on that prize of uptake of knowledge. Okay. Then your evaluation, I'm almost done here, is, don't just let it finish it, submit it, you're done. Always be coming back and looking at, you need to know, how will you measure this as successful? Well, obvious metrics, right? Uploads, downloads, page views, signups on your email newsletter, or social media. It's easy enough to get those kind of numbers on print. If you're doing a flyer, remember, not everybody is online. You're dropping off copies, you're keeping a record of where they're getting dropped off and how many, and do you need more, etc. And resources. Often, according to the course I took, the KT plan requirements are not aligning with the grant budget. You need to try and ballpark what roughly this is going to cost you. So depending on your campaign, you might need to use, as I say, a videographer. There's a small cost for hiring a freelance videographer, a designer, someone to print your flyers, website, you got some hours involved, whether it's paid or volunteer. I doubt you're going to do paid media because that gets really expensive. That's what HHS does with the Globe and Mail to get a big section in the newspaper. And you're done. So revisit, adjust as the results especially evolve, although you are doing this at the end of research, but still make sure you keep revisiting it. Okay, and questions. Remember, if you don't have time now, or you don't have any now, please reach out to me. My email is there. I'm always on Skype 5 days a week. I always have it on, and I'm very reachable. And then later, when we're back, you can find me on the second floor, right kitty corner to Dr. Yusuf's office. All right. Thank you all.
Great.
Any questions?
Thank you, Heather. So looks like in the chat, there's one question from Dr. Bungdiwala. It looks like he wants you to go a little bit more into how much we should budget for KT in a grant proposal.
Okay. Now, the course I took did not actually say how much. It simply mentioned that we don't necessarily actually add it in. So it does depend. I know that's not what you're hoping to hear. I don't have a dollar figure, but I think you should attach some value to the staff hours, whether it's $100 an hour, whatever you estimate. You don't need to probably break that down in the actual grant application. But if you're not sure of costs of things like printers or videographers or photographers, freelance, please reach out to me and I can give you that. I know those costs. And even my hours, if you need me to help you with something, I can give you an estimate of how many hours that will be. It's going to be different for every project, depending how sophisticated. If you're getting an app developed or you're getting a product or service, it's going to be a lot more expensive, and a lot more expensive than if you're just simply putting out some web pages, a flyer, things like that. And a lot of stuff can be done like social media stuff. Again, there's hours estimated. So please talk to me about how many hours it would take for me or you to do social media campaign, or to reach out and do a piece with the media.
Great. And
Thank you.
Okay,
oh
I
yeah,
hope that helped. Remember, a lot of it won't be cash up front. It will be hours, efforts, but it still needs to be allocated and estimated ahead of time. And I do have really, really cost-effective videographers and photographers in town. And I'm sorry to say that in this economy right now, in this COVID situation, they're very hungry for work. So I'm getting even better deals and not exploiting them, but that's a fact.
looks like we also have one question from Dr. Leong, which is basically that there's a lot of social media outlets. There's lots of platforms. How do you put it on everything? Is there a way to efficiently put it on everything? Because it would take a lot of time.
Yeah, I'm not a fan of putting it on everything. There's a lot of platforms that we don't use, and it's my job to do research to find out which ones our space is using. Twitter is by far the most effective for our space. If you know of one that you say, hey, Heather, you're missing this one completely, please bring it to me because I can't know everything all the time. I just became full-time like a week ago. So, but I really want feedback because if there's anything I'm missing. Facebook, I don't bother with at all. However, if you are doing a KT plan that is very much aimed at the mom and pop or like, pregnant people, there's a mom's group for South Asians, whatever it is, you can go there and that makes sense for that one KT plan. But in terms of general social media, really Twitter's your best bet. Here's what I found. All the scientists, clinicians are on Twitter, not all, but a lot. And all the staff, our research teams are on LinkedIn. And I have 300 employees I know for a fact are my first person contacts who work at PHRI, and very few of those are clinician scientists. So it really depends on who you're trying to reach. You need to know who's on what. So don't ever assume it has to be on every platform. If there's one we're not playing on, or please ask me.
That was great. That was really informative. Heather put her contact information up, and she said she's willing to talk to people.
Mhm.
I think just because it's 8 o'clock, we're gonna move on to the second speaker. Thank you again, Heather.
You're welcome. I'm going to send everybody a link to where I'm keeping the template plus this. I'm going to also share this presentation and all the material from the course. I have permission from the course organizers to share that with you. Thank you, everybody.
Beautiful, thank you. And her talk was recorded in case you missed a little bit of what she was saying. So now we're gonna move on to Aristides. So if you don't mind sharing your screen, hello. So Aristides obtained his medical degree from the University of Ionia School of Medicine in Ionia, Greece in July 2011. He completed his neurology training at the University of Ionia, and he did training as well at Kapodistran University of Athens in Greece. Okay, my Greek makes me sound very bad. Okay, he also completed his PhD thesis at the Department of Neurology at the University of Ionia, investigating the role of TEE in the diagnostic workup of patients with stroke. After his completion of his PhD training in neurology, he trained at the European Academy of Neurology at the Ruhr University, where he worked on the utility of transorbital sonography in patients with optic neuritis. He's been at MAC and PHRI since July of 2019 as a clinical fellow for stroke. And he's been a part of a number of projects. He's published over 160 papers in high impact journals with a particular focus on epidemiology, biostats, and meta research in the fields of acute stroke treatment and secondary stroke prevention. And today he's going to be talking about his first pilot RCT that he's leading on for the management of blood pressure following successful